Hello, everyone. This is Katrin with Disability Rights New York. Welcome to our podcast, Empire State of Rights Closed Captioned. We are here to bring you information on the most relevant topics regarding disability rights and advocacy. Today we have Ryan McDonald, PAT staff attorney here at DRNY. He's here to discuss 5 things you need to know about requesting prior approval from managed care or Medicaid. Hi, Ryan. How you doing today?
Good, how are you?
Good. Thanks for visiting with us over the phone today. So, Ryan, can you tell us a little bit about what this prior approval is?
Sure. So for folks who have managed care or Medicaid, the prior approval process is the way you request insurance coverage for durable medical equipment, or what's referred to in the industry as DME. DME can be anything as simple as a walker or as complicated as a motorized wheelchair. DME can also be things like a speech-generating device, a hospital bed, or any other device that is necessary for an individual to meet their needs in the home or in the community. Prior approval is a process that a managed care or Medicaid provider requires to ensure that the device requested from them is the least costly alternative and is also medically necessary for the subscriber. The industry calls it prior approval because essentially the federal agencies which oversee Medicaid and many private insurance companies have identified a list of expensive DME that they will not automatically provide coverage for. In order to obtain coverage for those items, the insurance subscriber has to request approval from the insurance company prior to placing an order. In short form, the prior approval process follows a routine process. An individual's medical team submits a prescription with a report from a medical specialist and a cover sheet with the appropriate insurance billing codes and quoted costs to the insurance provider. That information is reviewed by a medical professional working with the insurance company, who is typically in the same medical specialty as the person who provides the medical necessity form. The medical professional can then ask for additional information from the medical team and ultimately must approve or deny the request for prior approval.
So, where does an individual go when they need DME that requires prior approval?
The best place for an individual to start the whole prior approval process is by having a frank and honest conversation with their doctor. If they have DME that they've outgrown, or they have DME that is wearing out, or even if they notice that their physical abilities have changed, they should talk about this with their doctor. Most DME requires information outside of the specialty or expertise of a general practitioner, so in most cases, the individual will probably be referred to a specialist. A common prior approval scenario that I like to use as an example because it's easy to understand is an individual who needs a motorized wheelchair. When that individual goes to their doctor, they would likely be referred to a physical therapist to conduct what's called a mobility assessment. That assessment evaluates a person's current mobility, identifies potential mobility aids, and rules out less costly DME like a cane or a walker. That report from the physical therapist will provide the necessary medical information to rule out less costly DME like I explained before, and will establish medical necessity for the specific class of DME that the physical therapist recommends. That report will go back to the individual's doctor, who would use those findings as the basis for drafting a prescription for the individual. The report and the prescription would go to the client's chosen vendor. Depending on the specific situation, the physical therapist may have a vendor they work with, or the individual's doctor may refer them to a vendor who has a physical therapist on staff. The vendor then is required to complete a cover sheet with the prior approval paperwork that identifies the DME by the specific medical code required by the insurance company, as well as a cost estimate. The prescription, the specialist's report, and the vendor's information is all submitted together to the insurance provider as a packet. This is most often done by the vendor through a digital portal that's maintained by Medicare or managed care specifically for this purpose.
So that's really good information, and also one of the points that I wanted to just circle back to that you said in the beginning is that if something changes, this isn't just a one and done process. So if something in your health or history changes, you can change this process. Is that correct?
That is correct. So especially and because wheelchairs are just easy to understand and visualize. If you close your eyes, you can see a wheelchair, and it's easy for us all to do that. A person who has limited mobility or has a mobility-related disability may have a degenerative disorder that causes their mobility to degrade over time. After 5 years, they may need a more robust wheelchair, or they may be transitioning to a different type of mobility aid. And that's why it's necessary to have those conversations with your doctor so that you're having the best mobility that you can have in the community and be in the community as long as possible.
That's good to know. Now, when people start this process, and it sounds like it's a pretty lengthy process, about when should they expect to hear back from their insurance provider?
That depends on two factors. So the two factors are whether the prior authorization request was submitted on an expedited basis or how complete the information in the prior authorization packet was. So if an individual has made an expedited request, they should have an answer in as little as 2 business days from their insurance provider. An example of why you would request something on an expedited basis may be that you're requesting a life-saving device, such as surgically installed defibrillator in your heart or something of that nature that requires a much faster response than you would normally receive. If the prior approval materials are thorough and complete, under a normal circumstance, the review process can be completed within 10 business days. A wrinkle could be if there's information missing from the prior approval packet or the prior authorization materials, or if the medical reviewer at the insurance company has questions for the medical team, the process could become longer. It would be very unusual for the process to take longer than 30 days.
Wow, so that's a pretty good turnaround. Now, how are people notified if their insurance has approved the request for the DME?
That's a great question. So there's only 2 types of letters an individual can receive in response to their prior approval request. The first is an approval letter. That's the easiest one to get because it means that you're going to get the device that you need. The letter is sent to the individual, their medical team, the vendor, and it authorizes the vendor to order the DME that they quoted in the prior approval packet. The individual should follow up directly with the vendor to discuss delivery or any training they might need before they receive delivery of the DME. The second type of letter you could receive is what's called an initial adverse determination letter. That letter is what I like to refer to as a soft denial. It formally denies the request for prior approval and provides a reason why the device was denied. The individual has an opportunity to request, at that point, what's called a plan appeal. The plan appeal is an internal appeal with the insurance company that asks the insurance company to take a second look at what was submitted and perhaps ask follow-up questions if necessary. If you'd like to make a plan appeal, you have to do it within 60 days of the date on the denial letter, not the date that you receive it from the insurance company. The plan appeal could result in an approval letter, or it could result in what's called a final adverse determination letter. The final adverse determination letter is what I refer to as a hard denial from the insurance company. That means that there is no longer any substantive conversation that you can have with the insurance company about their denial. The next step at that point would be to initiate an administrative appeal with the New York State Department of Health, the Office of Temporary and Disability Assistance. You have 120 days from the date on the final adverse determination letter to request an administrative hearing. That's also a great time, if you would like to consider talking about what's happening with an attorney, because at that point you're creating a record that could eventually go to court.
So Ryan, this process, it seems like it's a little bit complicated and lengthy. Is there a reason why people have to go through this prior approval process?
Yes, there is. There's a very good reason. So there's the prior approval process is intended to protect both the individual subscriber and the insurance system, specifically Medicaid and Medicare, from fraud and abuse. Most, if not all, of the DME that requires prior approval is very expensive. DME like advanced motorized wheelchairs, specialized therapy bathtubs, advanced medical beds for wound care, all of those items can have price tags that range from $70,000 to well over $100,000. The need for a system to ensure that nefarious individuals are not abusing the system is obvious when you look at the costs of some of these items. However, the prior approval process is primarily intended to ensure that an individual is receiving the most appropriate DME for their individualized needs. Vendors make their money based on the costs of devices. So Medicaid and managed care allow them to bill a percentage above what the list price for those items would be to cover administrative costs and to allow for a profit from each sale of a device. The prior approval process protects individuals from vendors who would recommend inappropriate and much more expensive devices for individuals in order to make more money. Beyond runaway costs to the systems, individuals could receive DME that is grossly inappropriate for their needs and could also be very dangerous to them because it's not fitted to them, it's too advanced, or it's something that the individual couldn't control. that's something that the insurance company wants to check in on to make sure that a person isn't being put in a more dangerous situation than they might already be in. So the prior approval process is very frustrating, of course, but it's also necessary to protect both the individual subscriber and the insurance program from abusive practices.
That's great information. Now, if people are having any difficulty going through this process, are there areas or sources, places that people can go to receive assistance with this prior approval process?
Yeah, so you could go to your local independent living center. You could also call DRNY. We help folks through the process. There are often times where folks are not, their care team isn't listening to them, and we can help craft a good prior approval packet to make sure that all of the necessary information is being presented to the insurance company up front, and also that in the event that they deny it and deny the prior approval and it ends up going to an administrative hearing, that a very good, strong record has been established and gives us the best shot to make sure that the device is approved as prescribed.
That's so great. Thank you so much for your time today, Ryan. I really appreciate it.
Of course, anytime.
Empire State of Rights Closed Caption has been brought to you by Disability Rights New York, your source for disability rights and advocacy. If you enjoyed our program, and we hope you did, make sure to subscribe, like, and share this post. If there is a subject you would like us to discuss, please email podcast@drny.org. Tune in next time where we'll bring you more information on disability rights in the state of New York. The closed caption version of this podcast is available on our YouTube channel.